The nearest clinic from here is maybe about 15 miles. And other than that, it's Gallup or it's Fort Defiance. We're open to everybody. We don't make appointments, it's walk-in. You can come in and see us anytime and get whatever care you need, whether it's just a routine checkup, a physical, vaccines, you need blood work, we can do that. You just need to come and see a provider, you need a referral somewhere, you can come in and do that. That continuity, having someone you can go and see, know that you can get to see them, that's very important to somebody's care. Right now I'm going back to school for nursing. So I'm working my way through that. It's part-time right now because I'm working full-time, but that is really helpful, and I want to make that next step to become an RN, and eventually I want to come back to the mobile program.
We need to work at developing and building our own workforce. We need more Indigenous healthcare professionals so that there's the assurance that they will stay within their own communities and they'll have the trust of their community members when they seek care. The continuum of care we know currently is so dysfunctional, and it's because of staffing issues and the inability to retain providers within our different sites.
I did at one point want to move off the reservation, but ultimately it was just, this is home, and I wanted to help my own people.
One of the barriers can be staffing.
Did you start your compliance stuff for school?
It's a national trend. We just feel it more keenly where we are, is that it's really hard to focus on projects or push forward when we have challenges with staffing.
In any area that in our lives, our personal lives, our professional lives, it's so important to have a support system, and in order to be successful. Working with HEAL allows me the opportunity to educate others, to advocate, and to speak for those who aren't being listened to.
It's important to have role models like Dr. Begay because the representation is essential.
I feel like I'm trying to catch up on everything.
As an Indigenous woman, as someone who works in healthcare, as an academic, also as a mother, having someone that understands the context of those areas, who can support you, who can advise you, it really makes a big difference in my life. Sometimes we're in systems that weren't really created for us or necessarily meant for us, and so it really does take community to support one another, and takes community to grow.
I appreciate you. Oh, I appreciate you too. I'm so glad you're here.
He'll help me find my voice. And so it led me to pursue things that I wouldn't have before.
In order to assure that Indigenous people get quality of care, that they get culturally appropriate care, we need to increase that Native workforce. I need to make sure that there is still health care for my grandchildren when they grow up.